All right, in this video, we're going to talk about political ideology in terms of social policy. So, the different political parties, as well as politicians and American citizens, are going to have different stances on social policy and how the government should respond to social issues. So, members of society have needs such as education, social security, health services, and housing. So, social policy aims to ensure the welfare of individuals through legislative regulations. So, the preamble to the Constitution declares that the government will promote the general welfare of its citizens. However, that can be interpreted differently according to the different political ideologies. So Democrats and Republicans are going to have different ideas on how to balance those values of individualism, freedom, and equality of opportunity. So first, let's talk a little bit about some of the social welfare programs, okay? So the federal government and healthcare. Let's start with healthcare. So Medicare is a federal program that provides health insurance to seniors and the disabled, okay? So Medicare is one of those entitlement programs, and again, it pays for the elderly's health care. Medicaid, on the other hand, is a federal program that provides health care for the poor. Okay, so you have to be within the minimum income requirements, disabled or pregnant, in order to receive Medicaid. Now, Social Security and Medicare make up the largest part of social welfare spending and much of the federal budget. So these are some of those entitlement programs that we've talked about during the Congress unit, how it's a large part of that mandatory spending within the budget. So Medicaid and Medicare are types of health coverage. Social Security, on the other hand, is essentially a retirement fund. Okay, so you pay into Social Security over time as you are working, with the idea that when you retire, you will get that Social Security check to replace that income that you once had. Okay, so those are some of the different government programs. So let's talk a little bit about the Affordable Care Act in terms of health care and social policy. So, most Americans obtain health insurance from their employers. Okay, so health insurance is going to ease the cost of doctor visits, of prescription medicine, operations, other medical costs. So, a lot of politicians and some presidents have even favored the idea of a government based healthcare system. Okay, but up until 2010, most Americans were only getting their insurance through their employers. So in 2010, approximately 48 million Americans were uninsured, and others are going to struggle to pay healthcare costs. So that means that if you're uninsured, when you go to the doctor, you're going to have to pay that entire bill, whatever that might be. Okay, so we're looking at hundreds of dollars instead of just paying a copay of maybe $15 or $20, or not having to pay at all because your insurance covers it. So in March of 2010, President Obama signed the Affordable Care Act, which is going to overhaul the healthcare system. So this is the Obamacare, okay, that you have heard about, I'm sure, over time. And we'll talk a little bit more about it in just a minute. But there is going to be a really decisive line between conservatives and liberals in terms of support for this Affordable Care Act. Not one Republican attended the signing. So this is where you can really see how the different parties are going to have different ideologies concerning social policy, concerning healthcare. So the Affordable Care Act had some major provisions, including one, that employers with 50 or more employees had to provide health insurance. Two, that individuals must obtain health insurance or pay a penalty. That individuals can remain on their parents' health insurance until age 26. And insurance companies cannot exclude individuals based on pre-existing conditions. So the really big thing here that people got really upset about is this one, that individuals must obtain health insurance or pay a penalty. So if you weren't getting health insurance through your employer, you had to get some form of health insurance that was provided through this Affordable Care Act, so through this government system, or you are going to be penalized, okay? So that money is going to come out of your taxes, essentially. You're going to have to pay that penalty for not having insurance. So in 2012, the court upheld the individual mandate provision of the law. So the Supreme Court is going to uphold this. The individual mandate portion has since been struck down since President Trump took office. But at one time, if you did not have health insurance, you were going to have to pay a penalty for that. So liberals, okay, are going to argue in favor of this Affordable Care Act because they are arguing that health care should be widely available for all, and they're going to support the Affordable Care Act for that reason. Conservatives, on the other hand, are going to oppose the individual mandate, believing that healthcare decisions should be left up to the people that are purchasing the insurance. So conservatives tended to believe that private companies could do a better job providing healthcare services than the government, okay? So liberals argued healthcare should be widely available, whereas conservatives are going to believe that it should be left up to the people that are actually purchasing that insurance as in terms of what type of insurance they should get. So again, President Trump overhauled that individual mandate that said you had to have insurance or you would get a penalty in 2017. All right, so moving on from healthcare to school choice, okay? And it's important that you all understand this because as public school students, this is something that could potentially affect you. So Republicans and Democrats differ ideologically over education reform. Okay, so there has been this push for what is called school choice, and we actually do not have school choice in the state of Kentucky right now, but there are several states that do have a school choice program. So school choice reforms are going to allow parents and guardians to choose their students' schools, which may encourage competitions between schools. So school choice advocates support vouchers, which use taxpayer money to pay for tuition in private and religious schools. So, for example, many parents are choosing to send their kids to private schools, which again, often are religious. However, they still are paying local taxes or state taxes that support public schools, so the public school system. So they're paying taxes even though their kids aren't going to public schools. So some states are going to provide these vouchers, which are diversions of public funds to these families that lower or defray the cost of sending a kid to a private school. So proponents of school choice are going to argue that in offering alternatives to traditional public schools, it's going to make schools a better environment. So it's going to put pressure on public schools to retain students and keep funding by improving standards. So conservatives would argue that the freedom to choose the educational environment and curriculum for their children is fundamental, and they argue that private schools are creating competition for public schools to keep their students, so there's going to be this incentive for public schools to improve. However, opponents are going to argue that it's draining taxpayer dollars from already struggling schools and giving it to a lucky few schools. So, some will argue that it violates the Establishment Clause by giving money to religious schools, and we'll talk a little bit more about the Establishment Clause in a later unit, but this would be a violation of the First Amendment and freedom of religion, and could leave most public schools students behind and denying them equal opportunity. Okay, so this idea that if you're giving money to those private schools, then public schools are missing out on that funding that they otherwise would have gotten. All right, and that's where we're going to stop.